Ladies and gentlemen, good afternoon. You guys like the Peloton bike? Good bike. Exercise. No excuse, guys. Always exercise, even if you don't exercise. When you exercise, you better get a feel. Trust me. You guys doing awesome. Happy Monday. Looking forward to endocrinology this afternoon. You guys hear me okay? See me okay? Let me know. Thumbs up. Any point in time, things happen. Let me know. Now I'm up in Wisconsin. I have meetings all week. I do this for you guys, even though my sister lives up here. I have meetings with certain universities always. A lot of schools having problems with step one. Plus, they need help with some curriculum and some advice. So I do my best to keep up with everything. Now, my question to you is endocrinology is a beautiful system. I had a conversation, quite a few conversations actually, got them up here, with one student that wants to join the program. And but the problem is that she's done UWorld multiple times. I asked her, I said, what's your game plan? I'm gonna do it again. All right. So, and just to expand on this before we start, her NBMEs were not strong, her assessments were poor, but UWorld was 60, 70s, 80s, and 90s. Right away, I said to myself, that must be a problem, right? So I asked her, I said, I have one question, and this is out of respect to talk. So if you're scoring 70s, 80s, and 90s on your UWorld, how is it that on your assessment you're doing poor? Now, I said on NBMEs, they're not easy, right? So if you take an NBME, it's a fact that the questions are nothing like the actual exam and nothing like UWorld versus AMBOSS. So I have many students, I told her, that if you study UWorld and AMBOSS, you do very, very well, 70s, But when you go to NBMEs, you drop. That's a legitimate transition because it's very different, the question. So I tell students, if this is you guys, hope you understand, go into an NBME for your school, if the school's depending on these NBMEs for your progress to figure if you're going to go to sit the exam or not. I would suggest you practice old NBMEs offline, see how they're written, because if you're not familiar with them, you're going to walk in and take an NBME on your first attempt. You might not realize, you might not be happy with your results because they're two different questions. So long story short, this individual is going to continue using UWorld because she's happy and she's comfortable scoring 75, 85s, and 90s. And I said, well, be careful. I said, because unfortunately, you're going to be very upset later when you don't score. Point is, if you do old questions, you do incorrects over and over again, please do me a favor. Just promise me you could do them, but don't pat yourself on the back if you score high. The exam, you know the answer that's in front of you, right? You've seen it. What I want you to do is read the other answer choices to broaden your knowledge. Yes, it makes sense, doesn't it? I mean, I'm being honest, guys. I don't care. You have to take the test. I wish I found a magic pill to take you in less than 30 days to take the exam and pass. I've worked with people 30 days and less. However, the foundation has to be decent, right? Content has to be there. So if you are, and one more thing, think of it this way. Yeah, exactly, Dr. Nicole. And one more thing before we continue, you realize the more you prevent yourself from seeing new scenarios, the more comfortable you become, which then when you go to sit for the actual exam, you're going to be more scared or more nervous or more anxious when nothing looks familiar. Makes sense. The exam is going to be all brand new questions. So I never want to add a Q bank onto someone's plate when the test is in a few weeks from now. That's not it's scary. But if you have time to practice, I tell students, guys, questions are good. More questions are even better. New questions are nice. They're new scenarios. But we all feel comfortable. We don't want to feel uncomfortable, but then we get shocked if we don't do well. So if you have any friends or colleagues, please spread that word. I'm telling you, I care for you all. I told her, I said, most likely can't work with you. You want to work, that's fine. Jump on these sessions, but I don't know how much that's going to be if you don't see the numbers rise. So that being said, today we're doing endocrinology. Again, if you're using Q banks, please just if your time is limited, I would suggest looking at the answer choices and really grow from there. Because if your test is less than 60 days, you don't have time to do content. You don't have time to watch videos and really just do stuff that should have been done. Now it's about getting the points, right? So endocrinology is big. Endocrinology, we have many, many areas to get points. We have diabetes, we have thyroid, hypo. Kind of a heads up, any of these conditions have drugs involved, right? So antithyroidics, diabetes, anti-diabetics. These are points that I want to get if I was a test taker. So I'm working on a document. It's going to be a little extensive of where all the points are in the exam. Now I can't predict what your exam be, but I realize that people reach first aid, they keep reading first aid, they keep doing Q banks over and over again. They're following this path. And I was on that path too. I am working hard to really tell the people and expand the message and extend the message. Like, guys, you have to practice testing. So step one is all about points. Step two is about knowledge and knowing how to differentiate and how to provide a treatment. So for step one, let's work on connecting the points and get to move on. And doctors like Dr. Nicole for step two is about really knowing the differentials, which you have to diagnose, but then knowing how to treat the patient and how to choose. So let's raise our hands up high. We have questions today specifically selected for cases like men 1, 2A, 2B, diabetes insipidus, mellitus, and so on. So when you guys jump on, I really want you all to give me feedback. I could talk for hours, but this isn't what I do this for. I do this to have you guys come on like a workshop, practice what you know, realize what you don't know. Dr. P is going to come on and go from there. That's the whole point. Or else you're going to constantly read, and then fall backwards when you don't know the information. So Dr. Patel is on the West Coast. Dr. KP, what's going on?
Hi, not just I'm actually reviewing endocrine right now, so that's why I wanted to, you know,
There you go. You see, she's
volunteer
like,
myself today. See
huh?
how much I'm retaining, see what I still need to review. I'm still reviewing it, so it'll be good practice and
Good.
just con I'm just pushing hard to get out of my comfort zone and so I can be ready for test day.
I should get like a t-shirt. Get out of your comfort zone. I'm going to push you out of your comfort zone. Because
Yeah.
realistically, this is what happens. You'll never be 100% ready. It's always going to be, because it's a shelf life. Your memory is only so much. You could do so much reading, so much studying, and it's just going to feel like you're not doing enough, right? So that's why I applaud that. Thank you. And again, those of you who haven't done endo yet, or maybe in the near future, at least you can watch, participate, see what you remember, and then say, oh my God, I forgot all this. It's okay. When you get to endo, you have more to do versus, wow, I remember a lot of stuff, right? This is why I did the workshops. I felt really long and part of what to do to be able to work with a lot of people and still get the message across and get the quality up so you guys can pass. Because the system out there is damaged, unfortunately. More and more people are failing, which is affecting everything. So in the near future, don't be surprised when you see step 2, step 3 pass or fail. That's not a good thing, because then you'd have to show your resume that you have to want to be a surgeon, which means you have to think about what to do 2 years before you get into a residency to build your resume. But until then, let's not worry about it. Dr. Patel, question, where is your strengths in endo right now? Where do you feel strong?
I'm good with hyper versus hypothyroidism, I feel.
Nice.
I'm okay with like Graves' disease and all that. I feel like where I get messed up a little bit is when the thyroid disease talk about like the pregnancy getting involved and like the
Okay.
where the free T3 or T4 is getting affected and or like the other like what is it, Duquesne thyroiditis and
Uh-huh.
when they talk about the uptake scans, I kind of get a little bit flustered with that. And with the diabetes stuff, like diabetes 1 versus 2 and the drugs. I know we did go over drugs recently, which was really helpful,
Good.
but the practice makes perfect with the drugs.
Practice makes perfect. I created a list, and I'll share with you guys again of many, many farm questions. I just go in Amboss, type in anti, and then they pop up all the different topics, and I just put 100 questions together. I'll share with you guys again in the training hub, and also maybe we could do it before we finish, but in the chat. But the point is, you have to just keep reviewing over and over. And basically, like a question like this, I want you to do this. These terms are what you have to practice to know what they mean, because knowing Graves versus Hashimoto's is awesome. But they won't do that. They'll probably give you something like this. So let's attack
Mhm.
it. Now, we have a certain routine. Everyone has their own way. What works for you, by the way? I'll answer the question. What works for you?
What's
Do you
been
go
working
top
is
to bottom? What do you like? Bottom to top? What do you?
well, I think what we've been doing recently with you, like reading from physical examination and then going back from the top, has been a better technique for me than what I used to do before, which is
Okay.
before reading from top to bottom and then going back. I'm like, oh, what was being asked again, or what's important to be supporting the diagnosis, you know? So I think I like this new way that I learned from you recently, from the past, since I've been hopping on since end of June, has been really, I think, monumental for me.
Awesome. I'm happy. And again, there's many different ways to run this race. I just want
Yeah.
to save time, and I need time to be spent elsewhere. So if I can save time on a case, then I'm good to go. So do it how you like to do it. Attack everybody else here. Chat away. Put the answer in the chat box. You want to direct message me instead of putting a group, so I can give the opportunity to the doctor to do it on her own. Either way, attack doc. Let's go. Let's move.
Okay, physical examination shows a fine resting tremor of the outstretched fingers and a painless, firm, mildly enlarged thyroid gland. Her serum TSH is 0.08 and her erythrocyte sediment rate is 26.
Okay.
Radioiodine uptake of the thyroid tissue is diffusely decreased.
All right.
Microscopic examination of thyroid biopsy specimen is most likely to show which of the following is patient. So I'm gonna
Do we
go
know the
back and
lab
read.
value? Check out the lab value 2 seconds.
No, I didn't know the lab. I need to see if it's down or up.
Let's see.
For
TSH,
TSH.
TSH. Also type it. Here we go. TSH, where is the thyroid? TSH. So 0.4. Point.
So
So this
it's
is,
pretty low. It's very low. TSH is low.
and then
Um,
this is just inflammation. It's not anything less than 26 is not bad. 80.
yeah,
So
right.
very low. Okay. Keep moving.
Okay, and let's go from the beginning. A 31-year-old woman, gravida 1, para 1, comes to the physician for a 1 week history of heat intolerance, palpitations, and anxiety. So I already know this is probably going to be hyperthyroidism, uh, and that supports the low TSH as well. During this time, she has a 2 kg, 4.4 pound weight loss. Again, that's supporting hyperthyroidism. 6 months ago, she delivered a healthy boy with a birth weight of 3850 grams at 38 weeks gestation after uncomplicated pregnancy. She has a 20-year history of type 1 diabetes that's well controlled with insulin pump. She takes no medication. Her pulse is 102, which is pretty high. And her irregular in blood pressure is pretty high too. Um, so she does have some type of hyperthyroidism,
Okay.
and she just gave birth. So this might be from the pregnancy that she got it. That's how she got it.
Okay. So you have some indication, because there's spoon feeding in quite a few things. Like,
Mm-hmm.
okay. But now you have some, we'll see, pregnancy, right? Because she gave birth. Right? So she gave birth to very, very healthy. So this is
Mm-hmm.
postpartum stuff. Okay. Okay.
Yes,
Now,
some postpartum induced hyperthyroidism, it sounds like.
okay. Yes, yes. If you look at the answer choice, clearly to read the scenario, yeah. But I'm here to help you most you can, especially. So you look at the answer choices. Can you just whatever letter you want to choose, whichever one's choose a letter that you're familiar with and tell me what. Just tell me which one is. The more we can communicate and clarify the label, the better it is for us. So look at the answer choices. Can you tell me one by one which each one is?
B I is for sure hypothyroidism, not hyper. So I would take that one out.
Okay. Take out
Oh,
B for boy.
mhm.
Acidic infiltration, disrupted thyroid quality. Okay, we'll take that out. Keep moving.
Yeah. And then the next one, I'm going to.
This one. Whole hyperplastic follicular cells, evidence of thyroid reabsorption.
Yeah, what is that one for?